Good evening and welcome to our Communities Conquering COVID Town Hall. My name is Susan Wolford and I'm a general pediatrician in the Child Health Evaluation and Research Center at the University of Michigan and part of this CEAL team. I know I speak for the whole team when I say how glad we are that you've chosen to be with us here today. Before saying any more, our first order of business is for me to introduce Angelica Snyder, who will provide Spanish interpretation. And she will now give a brief introduction and announcement about the Spanish channel.
Thank you very much. Bienvenidos, buenas tardes. Gracias por asistir a nuestro webinar del día de hoy de Comunidades de Michigan Conquistando COVID. Si prefieren escuchar este webinar en español, seleccione el idioma Spanish, que es español, que aparecerá en la parte de abajo de la ventana de Zoom. Bienvenidas.
Thank you so much, Angelica. So, as mentioned, this town hall is part of the Michigan Communities Conquering COVID, or CEAL project, which is led by Drs. Erica Marsh and Dr. Barbara Israel. At this time, before we introduce our esteemed panelists, I'd like to hand over to Dr. Marsh, who will bring us some comments about the CEAL project and our sponsors.
Thank you very much, Dr. Wolford. It's a pleasure to be here with everyone tonight and this esteemed group of experts and friends. As Dr. Wolford said, my name is Dr. Erica Marsh, and this is actually our 8th town hall that we've had since COVID started. This town hall program is sponsored by MICHR, the Michigan Institute of Clinical and Health Research. And we are really excited that the CEAL project, which I co-lead with Barbara Israel, as Dr. Wolford mentioned, and Dr. Valbuena, one of our co-panelists, is one of our steering committee members, is part of CEAL, as well as Dr. Wolford is one of our co-investigators on that project. It's also sponsored by the Civic Grant, which is an R01 that we recently received to expand our civic, our COVID work to partner with community organizations and use community-based participatory research approaches to make sure that the community voice is leading these efforts. And we're also really excited to be able to partner with the Michigan Health Services and Miss Elfrida Rooks, who has been tremendously helpful, particularly with our with outreach and with our vaccine, our COVID vaccine pop-up clinic. So I want to make sure we say thank you to all the co-sponsors that have made not just tonight's town hall possible, but all of our town halls possible. Thank you so much, Dr. Wolford.
Thank you, Dr. Marsh. And we look forward to hearing today from, as was mentioned, an esteemed group of panelists, of which Dr. Erica Marsh is one. So I'll start by introducing her. As you've heard, Dr. Marsh is Faculty Director for the Community Engagement Program at MICHR. She's a professor at Michigan Medicine as well. We also have with us, as we have for every one of our town hall meetings, and so we can't thank him enough, Dr. Sandro Cinti, who's a professor of internal medicine and infectious diseases, co-chair of the COVID Vaccine and Therapeutics Task Force here at Michigan Medicine. And as a very active member of our CEAL team, we are also very grateful to have Dr. Felix Valbuena, who is the Chief Executive Officer at CHAS, the Community Health and Social Services, Inc. So thank you to all of you. We'd like to welcome you, and we'd like to welcome all of you who have joined us for the town hall. Please, we'd like to encourage you to put your questions in the Q&A, and we'll attempt to address them throughout this hour. If by chance we don't get to your question, not to fear, We will include them in our next town hall. And we use those questions to help us be aware of what topics are most important to you, so we can be sure that we will get to address those. So this evening, the topic we're focusing on is on misinformation. And our goal is to debunk the misinformation that's out there about COVID-19 and the vaccine. It makes me think of the album once years ago that was called The Misinformation or Miseducation, actually, of Lauryn Hill, which was based on a book, or was drawn from a book about misinformation, miseducation. And we have a lot of not just misinformation, but a lot of miseducation, that people are being fed a lot of information that is just not helpful and that is really leading to some very poor outcomes. So that's what we want to discuss today. And so to start off with, we'll ask comments that you'd like to make on this topic. So maybe we'll start with Dr. Cinti. Would you like to start us off with 3 to 4 minutes on comments about this issue of misinformation?
Absolutely. Thank you very much, Dr. Wolford. I don't know that I'll take 3 or 4 minutes. I want to hear the questions that are here, but the question of misinformation and the misinformation that's out there is a big issue, and it's gotten more and more prevalent as we go through this pandemic. It's hard. I don't think people are trying to look for the wrong source of information, and I think there's enough gray area in what we talk about, and maybe that will come up today, when there's gray area, people fill those gaps in, and I think we have to be careful. We have to try and understand why people have the ideas that they have. And when we talk about people not wanting to get vaccinated, or people don't get vaccinated, the reasons, and we brought this up here before, are many. It's not just one reason. Misinformation is part of it. Part of it is personal choice. Part of it is fear. And we've dealt with all of those. Each one of us, I'm sure, has spoken to patients' parents about what we know about vaccine, what we don't know, and what's blatantly wrong and patently right out there about the information that we're getting. I typically look at the sites that are the most reputable, which would be the CDC sites, the World Health Organization sites. There are a few other sites that I look at, but those would be the major ones. And it was a bit of a misstep last time when we spoke to a group of young people, and I realized that those sites sometimes aren't the best ones for everybody to get their information, particularly young folks who often are looking on Twitter, looking on Instagram, and we really need to reach out. And I said to the young folks, I said, I'm not going to be the one to do it, but I'm happy to work with people to be able to get that information out. But we have to be better at it. I think we're learning. I think we're learning every day. So I'll stop there, but I'm very interested to hear what some of the questions are and what the conversation here is.
Thank you so much, Dr. Cinti. I thought you gave the young people some great advice. You said anything with Dr. Fauci on it, believe it. And Dr. Fauci's on Twitter, and so, and Instagram. So I think you gave them great advice.
Woo.
All right, so I was just going in alphabetical order. So Dr. Marsh, would you like to bring us your opening comments?
Sure, Dr. Wolford. Again, thank you very much for this opportunity. I think misinformation is a very complex topic. I think some misinformation is accidental and unintentional. Unfortunately, I think a lot of misinformation is intentional. It has been quite concerning and quite frankly disheartening to me to see our leaders, our elected public officials, choose to in some cases use misinformation to create divisiveness and to cost people their lives, quite frankly, in order to create an environment where they feel that they can garner political support. I haven't seen our country in this place before in my lifetime. And so I think that it's really important for all of us as citizens to hold our leaders at every level accountable for our health and for their words, and for their actions, quite frankly. Most of us are not infectious disease docs, myself included. Most of us are not epidemiologists or statisticians, myself included. So we are all dependent on others with this expertise to relay the information. And having said that, I am a researcher, I am a scientist, and I think it's been shocking to me, all of I feel like for every truth, there are 10 untruths that are on the internet or on the radio or on television, and that people, like I said, have really leveraged this in a very political way to move agendas forward. Our health and our lives, quite frankly, are more important than any political agenda. And we have to demand better from our leaders at every level, and demand accountability, demand that people behave ethically and humanely, and we have to work to make sure that we're providing accessible literacy accessible options for people to get the facts. I think for some of us, I hear you, Dr. Cinti, it is the CDC and WHO, but for many people, that's not going to be a literacy accessible site. And so how do we create at national levels, state levels, local levels, community levels, trusted sources of information that are accessible for our neighbors, for our colleagues, to make sure that when we say go get the facts, that we know that they're actually going to get the facts, and that we can go to get the facts, and versus going to get propaganda.
Thank you so much. You're right. Such a complex issue. Thank you, Dr. Marsh. And so, Dr. Valbuena, over to you for your opening comments.
Thank you so much, Dr. Warfield. It is, I'm very grateful to have the opportunity to be here today to share thoughts on this very, very important topic. The only thing I would add from what Dr. Cinti and Dr. Marsh said is that, technology nowadays has united us across the globe. And we're able to communicate as if we were next door to each other. And unfortunately, the consequence of that is that there is a lot of information out there that will appear to be accurate when it's not. And being able to reach out to a trusted partner or a trusted leader in an area such as healthcare, whether it be your primary care provider or just a local leader, a pastor in your church, I think is extremely important to help, or a youth group leader for the youth to convey these messages that we see on official CDC and WHO sites and others, to really be able to educate the community and dispel all of those myths. And I think another challenge is that we have now, that because this is something new and we're learning about it every day, as we change guidelines, as we change recommendations, individuals are saying, see, they don't even know what they're talking about. And so that has hurt us a little bit along the way. But the fact that we try and be as transparent as we can when we communicate with individuals, and really share the successes and the great efforts that we're making across the world to vaccinate individuals to get past this, I think is what we need to continue to drive home in events like this, and events that are happening all across the country and actually all across the world, to really, really, really work with individuals, sometimes on a one-on-one basis, to really answer the very specific questions, the very specific concerns, and hear those myths that they're reading on Facebook or TikTok or whatever social media they're on, and really be able to explain, this is not the right information. The reality of these things are this. And once you have an individual in the family that gets vaccinated, really sees the benefits, and ideally that be one of the leaders, the matriarch or the patriarch of the family, to get them to bring everybody together to go ahead and get vaccinated, I think is something that we've been working on. But that one-on-one basis is where we're making the biggest headway in getting the community vaccinated, and really working point by point, which is tedious, but point by point to dispel the misinformation that we see every second of the day, and no matter what social media or media technology method you communicate with. Thank you.
Thank you so much. Excellent points. And you bring the idea that we need to dispel these one by one is so key. And so let's do some of that now with these with the question of the vaccines. And so there's a lot of information out there and a lot of misinformation out there. But based on what we know right now, what we actually know about these vaccines, I guess I'm going to say direct this question to Dr. Cinti. Knowing what we know right now, how safe would you say the vaccines are, and any concerns you have about the vaccines?
So the two things, safety is very good for all three. And so the vaccines that we'll talk about here mostly are going to be Moderna, Pfizer, which are the two mRNA vaccines, and then Johnson & Johnson, which we haven't been giving as much in this country, but is also has the EUA from the FDA. And recently, everybody probably saw this, the FDA approved Pfizer as an approved vaccine. So for a long time, there was a concern that this was under an emergency use authorization. So it wasn't really approved, but now Pfizer is really approved. And I suspect that is going to happen with Moderna also. They're safe. They've been given to hundreds of millions of people at this point. The people do get sore arms, they do get fever, they do get muscle aches for a day, but otherwise these have been very safe vaccines. There have been a few more severe side effects. Some people have gotten allergies associated with the vaccines, particularly the mRNA vaccines, the Pfizer and the Moderna. But those have been handled very well, and people are getting these and they are doing very well. Sometimes it leads to them not getting the second dose, but at University of Michigan, our allergists are working on those very few, maybe 10 out of 1 million people who get what's called an anaphylactic response, which is, many people know from a bee allergy or from a peanut allergy, similar things can happen with the mRNA vaccines. But again, that's very, very, very few and far between. There have been some episodes of people have heard of the myocarditis, which is the inflammation around the heart that's occurred with the mRNA vaccines. Again, probably anywhere from 2 to maybe 10 per million doses that are given, mostly in younger folks. And that has been identified. It was identified, and there have been a lot of presentations by the CDC about the actual threat, and what the CDC does, which is great in my opinion, is they look at the risk and the benefit. What is the risk, which is in this case heart inflammation, and what's the benefit? And in each time, if the risk outweighs the benefit, they'll say, let's not give this vaccine anymore. But that has not been the case. The benefit, meaning the protection you get from the vaccine, way outweighs the side effect potential. So they're extremely safe. I'll leave it open for others to weigh in, but I have no concerns about these. I've had all my family get them, and I've tried to convince some of my family who haven't got them to get them or get a vaccine. So they're good.
Thank you so much. In fact, as you raised the issue of the myocarditis, someone asked a question in the Q&A. Please address the myocardial implications specifically in regards to adolescent males. So yes. I think you addressed it a bit, but if you have a young man, a teenager, a 20-year-old male, would you still recommend the vaccine? Any special precautions they have to think about? Do they get a booster when it's time? Any thoughts about that?
I'll leave it over to Dr. Valbuena in a moment, but I would say absolutely. This was coming out as both my sons, who are 28 and 30, were getting vaccines, and I said, you need to get the vaccine. And so, yes, I would recommend that people get vaccinated. It's so minimal, and most people will do fine, even if they are one of the 1 or so in a million who get it.
Thank you so much. Dr. Valbuena?
Yeah, I wanted to add when Dr. Cynthia was talking about the risks and the benefits, I use that all the time because the vaccines are currently under the microscope in the spotlight. Any event that happens, those that are skeptical of the vaccines are saying, see, it doesn't work. But what I try and bring everybody back to as we're conveying this is everything that we do in medicine, a pill that you take for cholesterol, a procedure, a test that we do has risks and has benefits. Nothing is 100% perfect, but we always know that we're gonna, as health experts, we're always gonna recommend things that have much overwhelming benefit over the risks. And you know, yeah, we don't want anybody to have any negative side effects. We don't want anybody to die from these things. But we know that the benefit of getting the vaccine is so overwhelmingly effective and safe that we continue to offer it and recommend that individuals get it, even though we know, and we're prepared to deal with the effects, the side effects that can come from the vaccines as we're doing our vaccination campaigns.
That is so important, that risk benefit balance, getting that, understanding that the risk is so low, and understanding that there's a risk of getting things like myocarditis from COVID. So it's not like there isn't that risk. You can, in fact, the risk of getting myocarditis from COVID is greater than the risk of getting myocarditis from the vaccine. So yes, very, very important points. So just to cover a couple of other points of misinformation that I'd just like to address. People often wonder whether there are chips in the vaccine. I'm hoping we're hearing a resounding no from the panelists, right? No chips in the vaccine.
Yeah, I think that's one that we can say with absolute certainty that is wrong. There are no chips.
Correct. And if you're worried about being tracked, you're carrying a cell phone, so you can already be tracked.
Absolutely, very important points. People are worried that it changes their DNA. Is that even possible?
Well, so I can comment on that because and it's because of the mRNA vaccine. So I think when these first came out, I had very smart doctor friends who said, I'm a little concerned about that. It's going to change my DNA. And it doesn't. And the way this works, and is that okay to go through it quickly? What you get is a piece of genetic material that then gets destroyed. And the piece is the mRNA. And it's like, I've heard this described in different ways. One way is, people know Mission Impossible, that the Tom Cruise character gets the message, and then what happens to the message? The message is destroyed, right? And he still saves the world. So he gets the message and then takes that message and uses his team to save the world. The other one I've heard that's a good one too, is a Post-it. If somebody leaves you a message, my wife leaves me a message to say please get this. And I will see the message. I'll look at the post-it. I'll throw it away. That's the mRNA. Gets tossed. It's gone. The message has been received. And that's the way mRNA works. It doesn't incorporate into our cells. It doesn't stay around. It eventually gets destroyed completely. And then it's your body. So it's your body that actually takes care of you. So it's a little bit, to me, people would rather get the antibodies that are given. They'd rather get that than the vaccine, but the antibodies are foreign antibodies. With the vaccine, you get your own antibodies to protect you. So it's you protecting you. It's not somebody else's antibody. So those are actually much more risky in a way than getting the vaccine and having your own antibodies.
And much more short-lived.
Yes.
Yes. Absolutely. And it doesn't change our DNA because it doesn't even get into the center, the nucleus of our cells where our DNA is. It doesn't get there. It stays out in the outside part of our cell, like the white of the egg. It doesn't get into the middle like the yolk. It just stays in the outside part and then is destroyed. And final question about these myths about the vaccine. Can it give you COVID? Because some people are saying it's the people who get the vaccine that are spreading it. Can the vaccine give you COVID?
No, absolutely not. There's no part of there. It's a piece. And so it's the spike protein, right? COVID is a virus that is made up of pieces of DNA and spike protein and an envelope. They're very simple organisms, but all your body is making is pieces of the spike, and that's what protects you. So there's no virus there.
Absolutely. We just get that little recipe to make the spike protein. The recipe can only make the spike protein. It can't make anything else to do with the virus, so we cannot get sick from it. Wonderful. Right. All right. Moving on, a lot of questions are out there about, and this question is for Dr. Marsh. Specifically, there are lots of questions about the safety of the vaccine in regards to women and fertility. In fact, I actually believe a star very recently put it out there that, I think it was a cousin, I think that was a male, that their fertility was somehow impacted by by getting the vaccine. Or yes, I think that's what they were saying. It so doesn't make sense. It's hard to actually imagine. But in any case, what do you want to share about vaccines and fertility?
Thank you, Dr. Wolford. That is something that is highly prevalent, and as a reproductive endocrinologist and infertility specialist, it's a question that I get from my patients every clinic, and every patient wants to know what's the impact of this on their fertility, and they also want to know what is the impact in pregnancy. And there's no data at this point to suggest that the COVID vaccine has any implications in infertility or fertility overall. In pregnancy, the data are, quite frankly, I would say, less neutral and even clearer that you need to get vaccinated, because we know that in pregnancy, COVID has much worse outcomes if you're pregnant than if you're not pregnant. And we know the vaccine is protective in pregnancy, not only to the pregnant individual, but also there's benefit to the offspring as well. So I encourage all of my patients who are trying to get pregnant or who are pregnant to be vaccinated, because that is the safest thing for them. If they ask me, can you tell me there's zero risk? And, my answer is no, I can't tell you there's zero risk, but guess what? If zero risk is what you want, then I don't know where you can exist with that. That means don't get in your car, don't drive anywhere, don't eat anything, don't inhale, don't exhale, because there's just nothing that we're, there's nothing that we can say that has zero risk, or that there's not somebody in the planet who's had a poor outcome. But what we can tell you is that when we look over thousands and hundreds of thousands of cases, and in some cases, millions and tens of millions of cases, the risk far outweigh the benefits. Excuse me, the benefits far outweigh the risk. Let me be very clear. The benefits of being vaccinated far outweigh the risk. And that's what we want for you. Anyone who's gone to school in this country and most countries, we've gotten some vaccines. We've been required to get vaccines. All those vaccines, they have small risks, but the benefits, the lives that are saved, far outweigh the very, very, very small risk associated with those vaccines, whether it's flu or hepatitis or the varicella chickenpox vaccine. I mean, the list goes on. This is another vaccine. Is it newer? Absolutely. Is it a new technology? In a couple of cases, yes, it's a newer technology. But at this point, do we have enough data and have enough people taking the vaccine to say, hey, this is really safe, and it is particularly beneficial and important for people who are pregnant to be vaccinated? Yes, we do have data to say that, because we know the outcomes, again, of individuals who are pregnant who get COVID are far worse than any risk of getting the vaccine, and two, are worse than folks who are not pregnant. So I think we don't live in a world of 100% and 0%, unfortunately. There's always a little gray area, and I get it. Most of us aren't comfortable with the gray. We want to know there's zero risk, and I'm going to be 100% protected. There's no vaccine that is 100% protective, and there's no vaccine that has zero risk. But we do. Are you okay? At the end of the day, taking on a teeny bit of risk to get a huge amount of protection of protecting your household, your family, your neighborhood, your friends, your schoolmates, your colleagues at a faith-based organization, wherever you are. We want to get back to that, and to do that, we need to. We have the opportunity to be vaccinated and to reach herd immunity, which is when enough of us are vaccinated that we're largely protected and from developing or the number of new cases is minimal. So I would say no data on or no data to suggest that COVID is harmful to fertility in males or females. I'm not gonna, get into a debate with a rock star about what actually happened to her family member, but I would say it's very, very, very unlikely that it was related to the COVID vaccine. And, I would encourage everyone who's eligible to get vaccinated to get vaccinated.
Thank you so much, Dr. Marsh. And thank you for emphasizing there the importance of getting the vaccine if you are pregnant, and the benefit to both the pregnant person and to the child. So we need to take a break at this moment. We're going to pause for about 2 minutes or so to give our interpreter a break. When we come back, we're going to, there's been a lot in the chat about the fact that, some people just are not going to believe. And we're going to just maybe go to Dr. Valbreno to get some ideas of how we might counteract some of this misinformation in our communities. So We'll pause for a moment. All right. I think we are back here. Wonderful. Thank you so much. Okay. So as mentioned, hard to know what to do about all this misinformation that's out there. Any ideas that you could share with us, Dr. Balbeno?
I would start by saying, because I'm a family physician, my thought process in sharing as I educate the population that I work with, we see that for the most part, children will have a relationship with a pediatrician or a family doctor because of the physical exams required for school, the vaccinations, or if you have a chronic disease, you have diabetes, you have high blood pressure, you have high cholesterol, you have asthma, more than likely you'll have a relationship with a physician to help manage those. But individuals that are fairly healthy, don't have any medical issues going on, tend to not have that relationship. And I think that is crucially important to convey the message that everybody should have a relationship with a primary care provider, whether that's a pediatrician, family doc, internal medicine physician, to make sure that all of the preventive medicine that we need is managed and that we're keeping up on those things throughout our lives to make sure that we stay as healthy as we can so we can be productive, whether it's at work or school, whatever it is that we do. So I would first start by saying it's crucially important that everybody have a relationship with a primary care provider. Having that relationship, then you have the go-to medical expert that will answer all questions. And if they don't have them, we'll obtain them for you in a factual way. All the questions that you're going to have about your health in general, including the issue of the vaccine. And that's what we've been doing at the CHAS Center in our vaccination efforts. And we are, and I mentioned this earlier, doing the one-on-ones. So individuals that haven't been vaccinated, we sit with them. I've personally sat with more than a handful of individuals and spent up to a half hour going item by item, line by line, what is, the specific concern. And then once you've identified the issue and talked through that, having the vaccine on demand. So not having to call to make an appointment or go on a website to make an appointment. It's having the vaccine available at that point in time when they say, yes, I understand, I'm ready to take it. You take advantage of that moment and you give them the vaccine. And that's what we've seen is working best to get individuals vaccinated that still have not, for a host of reasons, including many of the ones that we've discussed today.
Great ideas. Thank you so much. So I'm going to go to a few more of the questions that are in the Q&A. Some of them are sort of very specific, so you may or may not be able to answer the specific question, but maybe let's give some general guidance. And this is to anyone who'd like to take it. How long after a severe case of COVID in an 11-year-old, the person was hospitalized for 2 days, will she continue to test positive? So how long after a case of COVID will you continue to test positive? And how likely is a reinfection?
I can start there. The testing positive can be quite a while, and we're just getting more information on kids, but they can sometimes shed. For influenza, they do shed a little bit longer than adults. It hasn't completely been the case with SARS-2, coronavirus 2, but they can shed for probably at least 7 days. We've seen that happen. And in terms of getting reinfected, very unlikely. There have been reinfections, but those are the exception, not the rule. The rule would be once somebody is infected, they're protected for a good amount of time. Some of the data shows up to 6 months. Getting vaccinated on top of having had been infected is better. So those people should still get vaccinated. But the reinfection rate is very, very low.
Excellent. Thank you so much. Okay, here's one I think we may have answered a bit, but I'll read it because it's here. Facebook friends and parents at our school are discussing if your daughter hasn't started her period yet, she shouldn't get the vaccine. What are the trials showing for the under 12 female who haven't had a menstruation cycle yet? Is it triggering their period or affecting their cycle?
There are no such trials that have produced data at this point looking specifically at that question that I know of. Dr. Cynthia or Dr. Valbuena, if you've seen something, let me know. But I feel like that's something that I would have gotten flagged and seen. Again, there's no data at this point to suggest that COVID would have any untoward or negative effects in terms of menstrual cycle initiation. There's not a, I think in general, there's a wide range of when young people start their periods. It varies by race, actually, of what a kind of a normal range is. But I would encourage, if your daughter is 12, which makes her vaccine eligible, I would encourage her to be vaccinated. There's no reason to withhold the vaccine based on the fact that that she hasn't started her menstrual period.
All right, thank you. So no evidence to date that there's any association between the vaccine and changing menstrual cycles. All
Correct.
right, we have another one. Actually, you hear this quite commonly. How do you respond to folks who say that they will boost their immune system naturally and don't need the vaccine because their immune system knows how to fight it? Dr. Valbuena, I'm figuring you hear this in clinic.
Yeah, I would say that boosting your immune system naturally, I guess, could be helpful, but you won't know how to defend yourself until you've been exposed to it. And the best way to get exposed to it is through the vaccine, to then be able to protect yourself. And so the boosting your immune system helps to a certain extent, but not to defend itself directly against the virus until you're exposed to it, either because you catch COVID or when you're introduced the spike protein, so that your immune system, stronger immune system, now that you've been boosting it, learns how to protect itself against the virus.
That's great. That's awesome. Because we need those layers of protection, right? I mean, we do everything that we can. And one of the best things we can do is the vaccine. That's like huge. And then there are other things, of course. We're going to wash our hands. We're going to physically distance. We're going to wear our masks. We're going to not stay in great crowds for long periods of time. And sure, eat as many green leafy vegetables as you can, exercise as much as you can, make sure vitamin D level is fine. All those things. Sleep enough, big one, sleep enough, do all those things because they're good. But you really want to have all the layers, including the huge layer of, vaccine protection.
Well, and one point to make is that being in the hospital and seeing the patients who get the sickest with COVID, they die because of their own immune system actually attacking them. Mm-hmm. And so the idea behind vaccination is you get a small dose that allows your body to see the virus, or the piece of the virus, the spike protein. It then responds, and it responds quickly when the virus hits you, if it ever does get into you. And it kills the virus without allowing the rest of your immune system, again, very strong immune system, turning around on you and getting your lungs filled up with water. So your immune system can do you in if you're non-vaccinated. A strong immune system may not be the best thing in people who get infected with coronavirus. And the way to get around that is to take the vaccine, because the vaccine provides specific, it's a bullet, it's a silver bullet for the virus, and it doesn't affect the rest of the immune system.
Excellent. Thank you so much. All right, here's one. Can you speak to herd immunity and how close or how far our state is from achieving herd immunity?
I would say that we tend to focus on our local community, our regional community, our state community, the United States. This is a global pandemic.
Right.
And yes, there are certain states that have done well, but until the entire population of the world gets vaccinated, we're not going to get there. And so we tend to look at a small piece of the globe, and that's the piece that we live in, the environment that we're in, and we're saying we're doing great. And I think that is important, but we also have to put it in the context of we are in a global pandemic, and we need to get the globe vaccinated, not just southeastern Michigan, the Midwest, the United States. It's much larger than we think. And so I think we get a false sense of security when we say we got to hit 70%, we got to hit 80%, we got to hit 90%, because we're doing it for us. We're working to get there, but that has to happen across the world.
Yeah, and that's a great point. I think that is the major point. A minor part of that is people saying, well, I don't need to get vaccinated because over 60% of my colleagues, or in the case of healthcare, over 90% of my colleagues are vaccinated. So why are you making me get vaccinated? And the answer is to protect others. And we really don't know the true herd immunity that's necessary. Dr. Fauci came out there and said initially 60 to 70%, and then the Delta virus came out, and the Delta virus is much more transmissible. So that means maybe 80 to 90%. So I agree. I agree, Dr. Valbuena. That was a great point. You don't want to focus too much on herd immunity. It's really protection of yourself and your family, and then the rest of the world. Really, we need to get the vaccine out there.
Excellent. Thank you so much. Okay, so one more here. How do you respond to people who say because they've had COVID in 2020, they don't need a vaccine?
I respond that the evidence shows that when they're getting vaccinated is better than getting infected and then vaccinated is better than just getting infected and not getting vaccinated. There's data out there that shows that.
Absolutely. And with all the variants coming along, making it more likely for reinfection, clearly getting the vaccine so that you can boost your ability to fight off this infection is the best way to go. All right, so we are getting close to the end. I want to give everybody a moment to make closing comments. We haven't even haven't reached the question of misinformation about treatment and misinformation about masks. So why don't we, if you want to, in your comments, if the things you want to wrap up about, if you could each also address the misinformation that's out there about masks and about treatment. And we went in alphabetical order when we started, but really anybody can jump in and start first. Well, we could go in reverse alphabetical order.
Erica, yeah, why don't
let's do that. Okay.
Sounds good. I would say that in closing, I think it's extremely, I mean, we've mentioned it many times that the best defense that we have against the virus right now is to get vaccinated. And so finding a location near you, you can go to vaccines.gov, put in your zip code, and it'll give you a list of places where you can get, if you don't have individuals in the family or colleagues or friends that have already gotten vaccinated, where you can go and get a vaccine. And then for those that are in the area of Detroit or Southwest Detroit, CHAS is vaccinating 6 days a week. You don't have to be a CHAS patient. We accept, we have an individual that came 2 months ago who had her first Pfizer vaccine in Barranquilla, Colombia, and had her proof of vaccination. It was the right time frame, and we gave her second dose of Pfizer. So we're open, ready, willing, able to talk through that misinformation or the questions, the concerns that you still have, and get you vaccinated. So the driving point, the final point is go to vaccines.gov and please get your questions answered and get vaccinated.
Thank you so much, Dr. Valbuena. Thank you. Dr. Marsh?
I would say there is a lot of misinformation around wearing masks and germs on masks. It's true that masks have germs. It's true that germs are everywhere. They're on our skin, they're on the clothing that we wear every day, just because bacteria are everywhere. But it's also true that wearing a mask is protective. The data are very, very clear on that. And it's not going to harm you to wear a mask, and that is going to end up getting germs that you already have, or bacteria that already exist on you. I think that's one of the ways in which people are actively trying to kind of undermine folks doing the right thing. We can't debate that there's bacteria on masks, because there's bacteria on every surface that hasn't been sanitized, that hasn't been cleaned with alcohol or some substance that that can kill bacteria. But the data are very clear that wearing a mask, one, is not harmful, and two, is protective to you and to those around you. So that's what I would say about that. Please wear a mask, and I would say particularly wear a mask if you're not vaccinated. That protects you and that protects the people around you. The second thing I would say is get vaccinated. COVID is real. There are people, for unclear reasons to me, who want to perpetuate a lie that COVID doesn't exist. COVID has killed hundreds and hundreds of thousands of people in the United States. It's killed tens of thousands of people in our state. It's killed millions of people around the world. It's no joke. So I don't understand the motivations of those who are saying COVID doesn't exist, but it is real. It is destroying families. It is destroying generations. And we now have it within our power to say no more. And that power lies in the vaccine. So I would encourage us to leverage that power, to leverage that autonomy, to leverage that self-direction, and not view getting vaccinated as giving into the system, but view vaccination as standing up for yourself and those who you love, and saying no more to COVID. I'm not going to be a victim to this virus that has taken so many lives from around the state, the country, and the world. I would say it's really important to find someone you trust who has a healthcare background or a public health background, who can answer questions for you. I know a number of us, through town halls like this, through written materials, through research like the CEAL and the civic studies that we talked about, and through community outreach, are really working hard to make sure that the data and the facts are accessible to everyone at every literacy level. We still have more work to do there, and we're going to keep working to make sure that happens. But know this: COVID is real. It is taking lives, and we have to stand up to it and say no more. We have the vaccine against COVID. Get vaccinated. Protect yourself, protect your family, protect those that you love.
Thank you so much, Dr. Marsh. Thank you. And Dr. Cinti.
Yeah, I couldn't have said it better, Erica. Yes, get vaccinated. The mortality rate. So somebody told me the other day, this is no worse than flu, and I took that as an affront, basically, because the flu kills about 40 to 50,000 people a year in a bad year. We've had 600,000 deaths in a little over than a year, so 10 times the mortality rate. And then if you look at the way vaccines have worked very well. If you look at the mortality rates since vaccines have been around, they're down lower in the setting of a virus that is spreading much worse than the first virus that came out, the alpha virus. So vaccines, there's no doubt that they work. There's no doubt that this is a bad disease that we need to treat. The things that work in terms of preventing this are masks. I agree 100%. We need to put out that statement that masks work. I was a convert. I didn't believe in masks in the beginning but the evidence is out there. But everybody has to wear them. And to give an example, there's a CDC article about a teacher that went to work with her elementary school class. She was sick. She had symptoms. She went into the classroom, did not wear a mask. All the kids were good wearing masks. She infected half the class by not wearing a mask, by not reporting that she had symptoms, by not doing the things we know work. The things that work in to treat, there are very few things. There's the monoclonal antibody. There's a drug called remdesivir. Many of you have heard of it. There's steroids, good old treatment that we use. There's a drug called tocilizumab, which sometimes works in the hospital. Other than that, not very much at all. Ivermectin, no, it can kill you if you take high doses. People are taking horse doses of ivermectin and ending up in the hospital with mental status changes. Plaquenil doesn't work. Aerosolized peroxide does not work, and it'll hurt your lungs. So please listen to the things that work. Masks work, vaccines work, distancing works, and the few medications that I talked about. But thank you, everybody. It's really great to work with all of you here.
Thank you, each and every one of you. Thank you so much to our panelists, to Dr. Marsh, to Dr. Cinti, to Dr. Valrena. We really appreciate all of the valuable information that you have shared. We know that if our car breaks down, we probably, most of us, the new cars, would not take apart the engine and try and fix it without some help. If you have a question about your health and about the vaccine, do the research with somebody who knows the body. So please find a primary care physician, a doctor, a nurse, somebody who has that health background who can help you do the best thing for your health. Be a victor, not a victim. Get the vaccine if you can. And with that, I would like to thank all of you for attending. Thank all those who have sponsored this program. Thank the CEAL Project, Civic, Elfrida Rooks and her department. Dr. Marsh, I'm going to hand it to you in case I have missed anyone. And be back and join us at our next town hall when we'll get to the questions that we may not have reached today. But thank you all, and please stay safe.
Thank you, Dr. Wolford, for your excellent moderation as always. I would just add MICHR to the sponsor list as a parent sponsor. And of course, got to give a huge shout out to Angelica for her incredible translation throughout these events and making sure that this work is accessible to as many as possible. So thank you, Angelica, for going nonstop and making sure that we are making these town halls accessible to those who are Spanish-speaking population and those who prefer Spanish. It's a huge honor to be here with all of you. Thank you for the work that you're doing in the community and in your everyday practices. And thank you. I want to echo what Dr. Wolford said. Thank you for everybody who's listening, who took the time out of their evening to do what we want you to do, which is listen, learn, make an informed decision. And to quote Dr. Wolford, to be a victor and not a victim. We've had enough victims of COVID. We don't need any more. More than 600,000 dead is enough. If that doesn't convince you that the virus is real, I don't know what will. Like I said, this is a virus that's wiped out generations. It's wiped out so many of our seniors, and now it's wiping out our young people as well. We have to stand up against it. And we have the power to do that with the vaccine. Get vaccinated, keep yourself safe. And with that, I'll say good night, everybody.